It was August 16th, 1977, and Elvis Presley was 42 years old. He was found unresponsive at Graceland. The world heard he died of a heart attack. But the truth was more complicated. It was a tragedy hiding in plain sight. Elvis, the king of rock and roll, the man with the swivel hips and the powerful voice, was deeply entangled in a web of prescription drug abuse. His public image was one of vitality, strength, and charisma. He was larger than life. But behind the scenes, a different story unfolded. A story of chronic pain, insomnia, and an escalating dependence on powerful medications. Doctors, friends, and family all played roles in this unfolding drama. Some tried to help. Others perhaps inadvertently enabled him. The official cause of death, cardiac arrest, did not tell the whole story. The medical examiner, Dr. Jerry Francisco, initially did not link Elvis's death to drugs. But the toxicology reports released much later painted a stark picture. They showed high levels of multiple prescription drugs in his system. These drugs, over years, had taken a heavy toll on his body, his mind, and his life. How did a global icon get to this point? What exactly was he taking? Who was giving him these drugs? And what were the silent, devastating effects these powerful chemicals had on his body day in and day out? People still wonder. They ask how someone so famous, so wealthy, and seemingly so protected could fall victim to something so common. His story is a powerful reminder of the dangers of unchecked prescription drug use, even when prescribed by doctors. It shows how the line between medicine and poison can blur. And it leaves us with many questions about the medical practices of the time, the responsibilities of those around him, and the lonely battle Elvis fought against his own demons. This wasn't just a heart attack. It was the culmination of years of decisions, symptoms, and substances that slowly eroded his health, leading to that final, heartbreaking day. Number 17. How could one man receive so many different medications from so many doctors? Elvis Presley's drug use was not a simple matter of one drug or one doctor. It was a complex and dangerous practice known as polypharmacy. This means using many different medicines at the same time. And for Elvis, it was on an extreme level. He was taking sedatives, hypnotics, opioids, barbiturates, stimulants, and various other pills, often prescribed by multiple physicians. This wasn't just a few pills a day. This was a daily cocktail of powerful substances. His personal physician, Dr. George Nicopolis, known as Dr. Nick, was a central figure. But he was not the only one. Records and testimony from the time show Elvis saw many doctors. He would get prescriptions from one doctor, then go to another for more, often without telling the new doctor about the existing medications. This practice is often called doctor shopping. It's dangerous because no single doctor has a full picture of what a patient is taking. This means they cannot assess the total risk of drug interactions or cumulative effects. According to specific records from the Tennessee Board of Medical Examiners hearings against Dr. Nicopolis in 1981, Elvis received an astounding number of prescriptions. Dr. Nick admitted to prescribing thousands of doses of drugs to Elvis in the last years of his life. For example, in the last 20 months alone before Elvis died, Dr. Nick reportedly prescribed over 10,000 doses of amphetamines, barbiturates, narcotics, tranquilizers, sleeping pills, and laxatives. That's an average of over 500 doses per month, but other doctors also wrote prescriptions. Elvis's road manager, Joe Esposito, recalled often picking up medication from different pharmacies for different doctors. A book called Elvis and the Memphis Mafia by Alana Nash, Billy Smith, and Marty Lacker talks about the sheer volume of drugs. It describes how Elvis would carry large suitcases filled with various pills on tour. These weren't just common painkillers. They included powerful opioids like dilaudid hydromorphone, demerol meperidine, and Percodan, oxycodone, and aspirin. He also took strong sedatives like placidyl ethchlorvinol and quaaludes methaqualone, along with various barbiturates such as nembutal, pentobarbital, and seconal secobarbital. To counteract the sedatives, he often took stimulants like amphetamines. This created a vicious cycle. He took stimulants to wake up and perform, then sedatives to come down and sleep. The dangers of polypharmacy are well known in medicine. When multiple drugs are taken, especially from different classes, they can interact in unpredictable ways. Some drugs can amplify each other's effects. This is called potentiation. For instance, combining sedatives with opioids can severely depress the central nervous system, leading to respiratory failure. This was a critical concern in Elvis's case. Dr. Nick's defense was that he was trying to control Elvis's drug use by prescribing safer alternatives or by giving him pills to avoid him getting them from illegal sources. But this approach ultimately failed. The sheer volume and variety of medications Elvis consumed show a profound lack of oversight in his medical care. It wasn't just an occasional pill for a headache. It was a constant revolving door of potent pharmaceuticals, creating a body that was constantly under chemical siege. The cumulative effect of these drugs was far greater than the sum of their individual parts. But what did these other doctors know about what Dr. Nick was prescribing? Did anyone truly understand the full scope of Elvis's daily intake? And why didn't a stricter system exist to prevent this dangerous practice? Number 16, did the constant search for drugs truly drive his actions? The term doctor shopping perfectly describes one of the key behaviors that fueled Elvis Presley's addiction. He didn't just rely on one doctor for his prescriptions. He actively sought out multiple physicians, often in different cities, to obtain the vast quantities of drugs he craved. This behavior is a classic sign of drug dependence and addiction. It's a relentless pursuit driven by the body's need for the drug and the mind's desire for its effects. Elvis often used his fame and charisma to get what he wanted. Doctors were often starstruck or felt pressured to help the famous performer. Some genuinely believed they were helping him manage pain or insomnia. Others might have simply given him what he asked for, not wanting to alienate a celebrity patient. Dr. Nick himself noted that Elvis would sometimes visit emergency rooms or other doctors while on tour, using different names to get additional prescriptions. This made it impossible for any single doctor to have a complete medical history or an accurate list of all the medications Elvis was taking. Specific examples of doctor shopping are detailed in various accounts. For instance, in the book Elvis by Albert Goldman, a controversial but detailed biography, there are descriptions of Elvis having different members of his entourage, the Memphis Mafia, pick up prescriptions from different pharmacies or doctors. This created a fragmented system where no one had oversight. It was a well-oiled machine for acquiring drugs, fueled by Elvis's demands and enabled by those around him. The legal fallout from this practice highlights its severity. In 1980, Dr. George Nicopolis had his license suspended by the Tennessee Board of Medical Examiners for overprescribing drugs to Elvis Presley and other patients. The board found that he prescribed massive amounts of drugs, including opioids, amphetamines, and sedatives, without proper medical justification and in quantities far exceeding legitimate medical needs. The testimony revealed that Dr. Nick sometimes provided drugs knowing Elvis was already receiving them elsewhere. His argument was that if he didn't give Elvis the drugs, Elvis would get them from illegal sources, which he believed was more dangerous. This argument points to the difficult position some doctors faced, but it also highlights the systemic failure to control Elvis's access to drugs. This constant search for drugs shaped his daily life. It dictated his schedule, his relationships, and his behavior. His medical records, as pieced together through various investigations and accounts, show a pattern of multiple prescriptions from different sources converging on one person. This was not a secret to some people around him. His ex-wife Priscilla Presley wrote in her memoir, Elvis and Me, about the constant presence of pills in their lives, and how she tried to hide them, only for Elvis to find more. The implications of doctor shopping are profound. It bypasses the safeguards of the medical system. It prevents accurate diagnosis and treatment, and it often escalates drug dependency because the patient is always able to find another source. For Elvis, it was a crucial part of his escalating drug problem, a behavior driven by the powerful grip of addiction. But what if a centralized medical record system had existed back then? Would it have made a difference? And how many other famous figures were engaging in similar practices without public scrutiny? Number 15, was his chronic pain just an excuse, or was it a real medical issue that drove his drug use? Elvis Presley suffered from various ailments throughout his adult life, and chronic pain was a significant one. It wasn't just a convenient excuse for drug use. There were genuine medical issues that contributed to his suffering, making his reliance on painkillers more complex than simple recreational abuse. Understanding these pains helps us grasp why he might have initially turned to and then continued to use such powerful drugs. One major source of his pain was a severely enlarged colon, a condition known as megacolon. This wasn't diagnosed until after his death during his autopsy, The colon was found to be twice its normal length and diameter. This condition would have caused severe, debilitating constipation and abdominal pain, a constant source of discomfort for years. His personal physician, Dr. Nicopolis, stated that Elvis suffered from severe, lifelong constipation and often had to take strong laxatives and enemas. This condition alone could justify the use of powerful painkillers to manage the constant discomfort. Another source of pain came from injuries sustained during his energetic performances and later from karate. Elvis was known for his dynamic stage presence. He would jump, kick, and move intensely. This physical strain took a toll on his body. He suffered from various sprains, muscle aches, and general wear and tear that any athlete might experience. In the 1970s, he became deeply involved in karate, even achieving a black belt. While beneficial for discipline, intense martial arts training can lead to injuries, adding to his physical burdens. Later in life, Elvis also developed glaucoma, a serious eye condition that can cause significant pain and vision problems. He would also experience severe headaches and migraines. Accounts from his stepbrother, David Stanley, in books like Elvis, My Brother, My Friend, describe Elvis experiencing extreme pain, sometimes locking himself in his room for days. The combination of these genuine physical ailments provided a real basis for needing pain relief. However, the problem escalated when he was prescribed strong opioid painkillers like Demerol, Dilaudid, and Percodan. While these drugs are effective for acute pain, their long-term use for chronic conditions often leads to tolerance, dependence, and addiction. His doctors, perhaps out of genuine concern for his pain, continued to prescribe these drugs, often in escalating doses as his tolerance grew. So, while the initial impetus for drug use might have stemmed from legitimate pain, the transition from pain management to dependence was insidious. The drugs offered powerful relief, but they also created their own problems, including rebound pain and heightened sensitivity to discomfort when the drugs wore off. This cycle made it incredibly difficult to break free, but did his doctors fully explore non-pharmacological pain management options? Could surgical intervention for his megacolon have been considered earlier, even if controversial at the time? And to what extent did his chronic pain mask other underlying health issues that were left undiagnosed? Number 14. How did his body adapt to such high doses, and what did that mean for his health? The human body is remarkably adaptable. This adaptability, however, can be a double-edged sword when it comes to drugs. For Elvis Presley, his body developed a profound tolerance to the massive quantities of drugs he consumed. Tolerance means that over time, a person needs increasingly larger doses of a drug to achieve the same effect. This is a common phenomenon with opioids, barbiturates, and many other psychoactive substances. And Elvis was taking doses that would have been lethal to a person without such a high tolerance. For example, the toxicology reports after his death showed concentrations of drugs like codeine, which, if taken by an average person, would likely result in death. Yet, because his body had adapted to these substances over many years, he was able to function, albeit often poorly, with these levels in his system. Dr. Nick and other medical professionals noted his extraordinary tolerance. There are accounts of Elvis taking multiple sleeping pills and still struggling to fall asleep, or taking handfuls of painkillers that would sedate most people, yet remaining conscious. But tolerance is not the same as immunity. While his body could process larger amounts without immediate overdose, the drugs were still causing damage. This constant chemical assault put immense strain on his internal organs. His liver, responsible for metabolizing drugs, would have been working overtime, potentially leading to damage. His kidneys, involved in excretion, would also have been under stress. Dependence is another crucial aspect. This occurs when the body physically adapts to the presence of a drug and experiences withdrawal symptoms if the drug is stopped or the dose is reduced. And Elvis exhibited clear signs of dependence. Accounts from his entourage mention his extreme discomfort, irritability, and physical sickness when he couldn't get his medications. This dependence made it nearly impossible for him to stop, even if he wanted to. The withdrawal symptoms, muscle aches, nausea, vomiting, diarrhea, tremors, seizures, and intense psychological distress were too severe. This fear of withdrawal further locked him into the cycle of drug use. In 1973, Elvis was hospitalized in Memphis for what was publicly called pneumonia. However, it was widely believed, and later confirmed by those close to him, that he was undergoing a detoxification attempt. He suffered severe withdrawal symptoms during this period, including a partial coma and hallucinations. This event highlights just how physically dependent his body had become. Dr. Nicopolis recounted this difficult period, stating that he tried to help Elvis detox, but the process was agonizing for Elvis and challenging to manage given his fame and the need for secrecy. The medical implications of this high tolerance and dependence are dire. It means his body was always fighting an internal chemical battle. His natural systems were constantly out of balance. This chronic stress contributed to his overall decline in health, weakening his organs and making him more vulnerable to other medical issues. But what lasting damage was done to his organs by processing such a relentless stream of potent drugs for so long? Did his doctors fully understand the long-term consequences of maintaining such high tolerance levels? And how much did the fear of withdrawal contribute to the inability of anyone, including Elvis himself, to truly break the cycle? Number 13. How did opioids specifically contribute to his physical decline and ultimate demise? Opioids were a cornerstone of Elvis Presley's drug regimen, prescribed initially for chronic pain but quickly becoming a central part of his dependence. Drugs like Demerol, Dilaudid, Percodan, and codeine are powerful painkillers. While effective for pain, their long-term use comes with a host of severe side effects that played a significant role in his physical decline. One of the most well-documented and debilitating effects of chronic opioid use is severe constipation. Opioids slow down the gastrointestinal tract. For Elvis, who already suffered from an enlarged colon megacolon, this effect was particularly devastating. The autopsy confirmed the severity of his megacolon. Dr. George Nicopolis often prescribed strong laxatives and even performed enemas at Graceland, trying to alleviate his severe bowel issues. This chronic constipation caused immense discomfort, abdominal pain, and contributed to his overall sluggishness and bloating. It was a constant agonizing problem that likely fueled his need for more pain relief. Beyond gastrointestinal issues, opioids can cause respiratory depression. This means they slow down a person's breathing rate and depth. When combined with other sedatives like barbiturates or tranquilizers, this effect is amplified. This is a common cause of overdose death. While Elvis's official cause of death was cardiac arrest, the toxicology reports showed multiple opioids in his system. These drugs would have suppressed his breathing, especially during sleep. This suppression of the central nervous system, where the brain's signals to breathe are dampened, puts immense strain on the heart and other vital organs. Opioids also affect the cardiovascular system. While not a direct cause of heart attack, chronic use can contribute to overall cardiovascular stress. His weight fluctuations, often linked to his drug use and poor diet, would have added to this stress. The constant yo-yoing of his system, alternating between stimulants and depressants, meant his heart was under abnormal strain for years. Furthermore, opioids caused sedation and cognitive impairment. This affected his ability to perform, remember lyrics, and even interact normally. There are numerous accounts from his concerts in the 1970s of him appearing lethargic, slurring words, or forgetting lyrics. This wasn't just fatigue, it was the direct effect of the drugs on his brain and body. His judgment was impaired, and his reaction times slowed. The toxicology report findings were stark. The presence of several opioids, including codeine, at levels higher than therapeutic, pointed to significant physiological impact. While not explicitly listed as the primary cause of death, the medical consensus now is that the combination of these drugs, including the opioids, severely compromised his respiratory and cardiovascular systems, setting the stage for his cardiac arrest. The chronic effects of these drugs essentially weakened his body's ability to cope with normal physiological demands. But how did doctors justify the prolonged prescription of such potent drugs, knowing these severe side effects? Could better monitoring of his gastrointestinal health have alerted them to the dangers earlier? And how much did the shame and secrecy surrounding his bowel issues prevent open discussion and effective treatment? Number 12. What role did sedatives and barbiturates play in his daily struggles and eventual collapse? Beyond opioids, Elvis Presley relied heavily on sedatives and barbiturates. These drugs, like Placidol, Quaaludes, Nembutal, and Seconal, were primarily used to combat his severe insomnia. But just like the opioids, their long-term and high-dose use brought its own set of devastating side effects, profoundly impacting his daily life and contributing to his overall health decline. Insomnia was a persistent problem for Elvis. His demanding schedule, the constant travel, the adrenaline from performances, and likely the effects of the stimulants he also took, made it incredibly difficult for him to sleep. So he turned to powerful sedatives to force his body into rest, but these drugs are not natural sleep. They suppress brain activity, leading to a kind of drugged unconsciousness rather than restorative sleep. The immediate effect of these drugs was extreme drowsiness and lethargy during his waking hours. Friends and family and even concert attendees often observed him appearing dazed, slow, or confused. His cognitive function was significantly impaired. He would forget things, struggle to follow conversations, and his speech would often be slurred. This was particularly evident in his later performances, where his verbal coherence and stage presence sometimes suffered. Like Priscilla Presley, in her book Elvis and Me, describes him often being in a state of stupor, disconnected from reality. The long-term use of barbiturates, especially in high doses, can lead to serious neurological problems. It can impair motor coordination, balance, and fine motor skills. This could explain some of his clumsiness or unsteadiness mentioned by those around him. More critically, combining barbiturates with opioids is extremely dangerous. Both drug classes depress the central nervous system, particularly the respiratory drive. When taken together, their effects are synergistic, meaning they amplify each other. This significantly increases the risk of respiratory arrest and accidental overdose. The toxicology report noted the presence of multiple depressants, underscoring this dangerous combination. Withdrawal from barbiturates can also be life-threatening, even more so than opioid withdrawal. It can cause severe seizures, hallucinations, and delirium. This adds another layer of difficulty to any attempt to detoxify. The fear of these intense withdrawal symptoms would have made it even harder for Elvis to reduce or stop his intake. The 1973 hospitalization, where he experienced withdrawal symptoms, likely included effects from both opioid and sedative cessation. The sedatives also created a paradoxical cycle. To counteract the excessive drowsiness, he would often take stimulants. This meant his body was constantly being pushed and pulled between extremes, never finding a natural rhythm. This constant chemical roller coaster would have put immense strain on his brain and body, disrupting normal physiological processes and contributing to his overall physical and mental deterioration. But did his doctors fully explain the non-restorative nature of drug-induced sleep? Were other, less dangerous sleep aids explored before resorting to such potent barbiturates? And how much did the societal understanding of sleeping pills at the time downplay their true dangers? And number 11, how did stimulants, meant to keep him going, ultimately burn him out? In a desperate attempt to maintain his grueling schedule and counteract the sedative effects of his other medications, Elvis Presley also frequently used stimulants. And amphetamines were part of his daily regimen. These drugs, often prescribed to keep him awake and energetic for performances or recording sessions, created a vicious cycle that ultimately contributed to his physical and mental breakdown. Stimulants, like amphetamines, speed up the central nervous system. They increase alertness, reduce fatigue, and can even suppress appetite. For a performer like Elvis, facing intense demands and suffering from the lethargy induced by opioids and sedatives, they offered a temporary boost. He needed to be on for his fans, his career, and his image. But this temporary boost came at a very high cost. One of the most immediate side effects of amphetamine use is severe insomnia. While they might allow a person to stay awake for extended periods, they disrupt natural sleep patterns, making it even harder to achieve restful sleep once the drug wears off. This pushed Elvis deeper into his reliance on sedatives and barbiturates, creating the deadly stimulant-depressant seesaw that characterized his drug use. He'd take uppers to perform and stay awake, then downers to try and sleep. Chronic use of stimulants can also lead to a range of severe cardiovascular problems. They increase heart rate and blood pressure, putting immense strain on the heart. For someone already struggling with weight issues and a family history of heart disease, this was particularly dangerous. Long-term use can contribute to arrhythmias, irregular heartbeats, and even sudden cardiac events. The toxicology reports from his death did not directly implicate stimulants as the primary cause, but their chronic use would have significantly contributed to the overall stress on his cardiovascular system, weakening it over time. Mentally, stimulants can induce paranoia, anxiety, and even psychosis, especially in high doses or with prolonged use. There are numerous accounts from his inner circle of Elvis experiencing episodes of extreme paranoia, irrational fears, and dramatic mood swings. He often carried guns and was intensely suspicious of people around him. While some of this could be attributed to personality, the chronic use of amphetamines would have certainly exacerbated these tendencies. His stepbrother, Rick Stanley, in his book Caught in a Trap: Elvis Presley's Tragic Addiction, details instances of Elvis's erratic behavior and paranoia fueled by these drugs. The energy provided by amphetamines is artificial. It pushes the body beyond its natural limits, leading to exhaustion and crashing when the drug wears off. This constant demand on his body, forcing it to perform when it should have been resting, undoubtedly contributed to his overall physical deterioration. It was a borrowed energy that came due with severe interest, but did anyone around him recognize the signs of stimulant-induced paranoia, or was it dismissed as eccentricity? Were there attempts to substitute stimulants with safer non-pharmacological energy boosters? And how much did the need to maintain his demanding performance schedule directly contribute to his reliance on these drugs? Number 10. How did different drugs mix to create an even deadlier cocktail inside his body? The most dangerous aspect of Elvis Presley's drug use was not just the individual drugs themselves, but the lethal combinations he ingested. This phenomenon, known as drug interactions, creates effects far more severe than any single drug could produce on its own. For Elvis, his body was a constant chemical experiment, and the results were disastrous. He frequently combined central nervous system depressants. This included opioids like codeine, Demerol, Dilaudid, barbiturates like Nembutal, Seconal, and other sedatives like Placidol, Quaaludes, Valium. When these drugs are taken together, their depressant effects are synergistic. This means they don't just add up, they multiply. Both opioids and barbiturates suppress breathing. Combining them can lead to profound respiratory depression, where breathing becomes dangerously slow and shallow, eventually stopping altogether. This is a common mechanism for overdose deaths involving multiple drug classes. Dr. Nix stated in his testimony that he worried constantly about Elvis accidentally overdosing due to these combinations. The presence of these multiple depressants was a key finding in the toxicology reports following his death. The sheer number of drugs found in his system, including multiple benzodiazepines, barbiturates, and opioids, all central nervous system depressants, strongly points to their cumulative effect as a major factor in his cardiac arrest. The heart, already under strain, would have been severely compromised by the reduced oxygen intake from depressed respiration. Adding to this dangerous mix, Elvis often took stimulants, amphetamines, to counteract the sedating effects of the other drugs. This created an incredibly stressful situation for his cardiovascular system. Imagine revving a car engine to its maximum while simultaneously trying to apply the brakes. The heart rate and blood pressure would surge from the stimulants, then plunge from the depressants. This constant fluctuation, this chemical tug-of-war within his body, put immense strain on his heart over many years. It could contribute to arrhythmias, hypertension, and overall cardiovascular damage. Liver function would also be severely challenged by these interactions. The liver is responsible for metabolizing most drugs. When multiple drugs are present, they compete for the same metabolic pathways. This can lead to increased concentrations of some drugs in the bloodstream because the liver can't process them fast enough. This effectively increases the dose and the toxicity of the drugs. Acetaminophen, often found in combination painkillers like Percodan, is also highly toxic to the liver in large doses. The book The Death of Elvis, What Really Happened, by Charles C. Thompson II and James P. Cole, delves into the complexity of the drug interactions, highlighting how difficult it was for even medical experts to untangle the exact sequence of events, but emphasizing the synergistic effects. This deadly cocktail wasn't just a one-time mistake. It was his daily reality for years. The human body is resilient, but there are limits. Elvis pushed those limits every single day, and the cumulative effect of these interactions slowly but surely eroded his health, ultimately proving fatal. But did any of his prescribing doctors ever communicate with each other to understand the full scope of his medication intake? Was there a lack of understanding about drug interactions among medical professionals at the time? And how much did Elvis himself understand the dangers of mixing these powerful substances? Well, number 9, how did his liver handle the constant onslaught of chemical compounds? The liver is the body's primary detoxification organ. It metabolizes drugs, alcohol, and other toxins, breaking them down so they can be excreted. For Elvis Presley, whose body was a veritable pharmacy, his liver was under an unimaginable and relentless assault for years. This constant chemical burden would have undoubtedly had a significant impact on its function and overall health. Every pill Elvis took, every dose of opioid, sedative, or stimulant had to pass through his liver. This meant his liver enzymes were constantly working overtime. While the liver is remarkably resilient, there's a limit to how much it can handle. Over time, chronic exposure to high levels of multiple drugs can lead to liver damage. This can manifest as inflammation, fatty liver disease, and in severe cases, cirrhosis or liver failure. Specific drugs Elvis used are known to be hepatotoxic, meaning they can be damaging to the liver. For instance, combination painkillers that contain acetaminophen like Percodan, which contains oxycodone and acetaminophen, are particularly dangerous to the liver in high doses. Acetaminophen overdose is a leading cause of acute liver failure. While there's no definitive report detailing severe liver failure in Elvis's autopsy, the chronic stress from these drugs would certainly have impacted its function, even if not immediately fatal. When the liver is constantly busy metabolizing multiple drugs, it can become less efficient at other vital functions. These include producing proteins, storing energy, and filtering blood. This reduced efficiency could contribute to a general decline in health, affecting metabolism, energy levels, and overall detoxification. A liver that's constantly struggling is a body that's constantly struggling. Consider the sheer volume, thousands of doses of various drugs over years, each one requiring metabolic processing. This chronic workload could lead to cellular damage within the liver, impairing its ability to regenerate or function optimally. Even if the liver didn't completely fail, a compromised liver would put extra stress on other organs, contributing to a systemic breakdown. The medical community today has a much clearer understanding of drug-induced liver injury. However, in the 1970s, while the dangers of certain drugs to the liver were known, the concept of such extreme polypharmacy and its cumulative effect on the liver was perhaps less thoroughly appreciated in a clinical context outside of specific toxicology studies. Dr. Nick and other doctors may not have fully grasped the silent toll these combinations were taking on Elvis's liver. But did Elvis's medical tests ever show elevated liver enzymes? And were those results adequately interpreted? To what extent did his poor diet and other lifestyle factors exacerbate any drug-induced liver damage? And what would a modern toxicology and pathology analysis reveal about the long-term state of his liver? Number 8. What silent damage was being done to his kidneys by all those medications? Just like the liver, the kidneys play a crucial role in eliminating drugs and their metabolites from the body. They filter waste products from the blood, maintain fluid balance, and regulate electrolytes. For Elvis Presley, who was consuming a vast array of medications, his kidneys were also under immense and chronic strain, silently working to process and excrete the chemical overload. Every drug Elvis ingested, once metabolized by the liver, had to be filtered and excreted by the kidneys. This meant a constant high workload. While kidneys are robust, prolonged exposure to high levels of certain medications can be nephrotoxic, meaning they can damage the kidney tissue. Some pain medications, particularly NSAIDs, non-steroidal anti-inflammatory drugs, when taken chronically, are known to cause kidney damage. While opioids and sedatives are primarily metabolized by the liver, their breakdown products still need kidney excretion, adding to the burden. A compromised kidney function can lead to a buildup of waste products in the blood, affecting other organ systems. It can also disrupt fluid and electrolyte balance, which is crucial for heart function and overall cellular health. Given Elvis's problems with fluid retention and swelling in his later years, as documented by some members of his entourage and in medical reports, kidney strain could have been a contributing factor. For example, his bloated appearance in some later photos could be indicative of fluid retention, which can be a sign of kidney issues or cardiovascular problems compounded by drug use. Chronic dehydration, which can sometimes accompany opioid use due to a suppressed thirst mechanism or general neglect of self-care, can also put stress on the kidneys. Similarly, the constant shuttling of his body between dehydration and overhydration from excessive fluid intake or IV fluids administered by Dr. Nick to flush his system would have presented a challenge to his kidneys' regulatory functions. The long-term effects of multiple drugs on kidney health are complex. Certain drugs can interfere with the kidney's ability to filter blood effectively, while others can cause direct damage to the kidney tubules. A full assessment of his kidney function during his life is difficult without detailed medical records, but it's medically plausible that his kidneys were under considerable stress. The autopsy reports for Elvis, while extensive on some findings, did not highlight kidney failure as a primary cause of death. However, chronic kidney stress or subclinical dysfunction might not always be immediately evident in gross autopsy findings. The cumulative effect of these medications could have weakened his kidneys over time, making them less capable of responding to other physiological stresses. This could contribute to overall systemic weakness and make him more vulnerable to the final cardiac event. But were his kidney function tests ever routinely monitored? Did his doctors understand the potential nephrotoxic effects of the specific drug combinations he was taking? And how much did his overall poor health mask potential kidney issues that were never fully addressed? Number 7. How did his heart withstand years of constant drug-induced stress and ultimately give out? Elvis Presley's cardiovascular system was under immense chronic stress for years due to his lifestyle and, crucially, his profound drug use. His heart, the pump of his life, ultimately gave out, leading to his death from cardiac arrest. Understanding how the drugs impacted his heart is central to grasping the medical tragedy. Firstly, stimulants like amphetamines significantly increase heart rate and blood pressure. For years, Elvis used these to counteract the sedating effects of other drugs or to boost his energy for performances. This constant acceleration of his heart, forcing it to work harder and faster, put incredible strain on the muscle and the blood vessels. Sustained hypertension and tachycardia can lead to an enlarged heart cardiomegaly and increased risk of arrhythmias, irregular heartbeats, which can be fatal. Secondly, the cyclical nature of his drug use uppers, followed by downers E, meant his heart was constantly being yanked between extremes. Imagine a heart rate accelerating sharply, then plunging dramatically. This kind of physiological seesaw is extremely taxing. It can disrupt the heart's electrical rhythm, making it unstable and prone to fatal arrhythmias. Thirdly, respiratory depression caused by opioids and sedatives meant his body, and critically his heart, was often deprived of adequate oxygen, especially during sleep. When breathing is shallow and slow, oxygen levels in the blood drop. The heart then has to work harder to pump oxygen-depleted blood around the body, putting it under further stress. Chronic hypoxia can damage heart muscle over time. Fourthly, Elvis had a family history of heart disease, with his mother, Gladys, dying young from heart-related issues. This genetic predisposition made him even more vulnerable to the cardiovascular stress induced by drugs. His fluctuating weight, often a result of his poor diet and drug-induced metabolic changes, also contributed to cardiac strain. Obesity is a known risk factor for heart disease, increasing the workload on the heart. The autopsy report noted an enlarged heart, which is consistent with chronic hypertension and prolonged cardiac strain. While the official cause of death was cardiac arrest, the toxicology report, which revealed the presence of multiple drugs, indicated a highly compromised system. The medical consensus now views his death as a complex interplay of his underlying health issues, his family history, and the profound, sustained chemical assault on his cardiovascular system by the drugs. The cumulative effect of years of polypharmacy created an environment where his heart was primed for failure. Dr. Nikopoulos stated that Elvis suffered from hypertension and an irregular heartbeat. He tried to treat these conditions, but the constant drug use undermined any medical intervention. His heart simply could not withstand the years of constant chemical and physical demands placed upon it. But could earlier, aggressive intervention for his hypertension and heart issues have prolonged his life, even with drug use? How much did the lack of regular comprehensive cardiac monitoring contribute to the tragic outcome? And why wasn't the connection between his drug regimen and his heart health more forcefully addressed by medical professionals at the time? Number 6. How did his body's waste disposal system become so catastrophically backed up? One of the most physically agonizing and medically significant issues Elvis Presley faced was severe chronic constipation, leading to a condition called megacolon. This wasn't just a minor discomfort, it was a debilitating problem that severely impacted his quality of life and was a major finding at his autopsy. It revealed just how profoundly his internal systems were disrupted. The primary culprit for this extreme constipation was his heavy and prolonged use of opioid painkillers. Opioids are notorious for slowing down the motility of the gastrointestinal tract. They essentially paralyze the muscles that move waste through the colon. For someone taking such high and consistent doses of opioids, the effect would be profound and unrelenting. But it wasn't just the drugs. The autopsy revealed that Elvis actually had an anatomically enlarged and elongated colon, a condition known as megacolon. This meant his colon was already predisposed to inefficient waste removal. The combination of this pre-existing condition with the powerful constipating effects of opioids created a catastrophic situation. His colon would become packed with stool, leading to immense pressure, severe pain, and bloating. Accounts from his personal physician, Dr. George Nikopoulos, and members of his entourage like Lamar Fike and Joe Esposito consistently speak of Elvis's struggle with his bowels. Dr. Nick frequently administered strong laxatives, enemas, and even manual disimpaction to provide relief. This was a daily, often humiliating, struggle for Elvis. The accumulation of waste was so severe that it contributed to his often bloated appearance in later years. In a famous quote, Dr. Nick described the contents of Elvis's colon as being 4 to 5 months old, a shocking revelation that underscores the severity of the problem. This chronic impaction would cause a constant level of abdominal pain, which then would drive him to take more painkillers, creating a cruel and self-perpetuating cycle of pain and drug use. The megacolon itself, if left untreated, carries risks beyond discomfort. It can lead to toxic megacolon, bowel obstruction, and even perforation, all of which are life-threatening. While Elvis's autopsy did not list these as the direct cause of death, the compromised state of his gastrointestinal system would have added immense stress to his entire body. It would have led to reabsorption of toxins, poor nutrient absorption, and a general state of ill health that weakened his system. This physical manifestation of his drug use highlights how deeply and destructively the medications had altered his body's basic functions. It wasn't just his mind or his behavior that was affected, his very internal plumbing was failing, literally backing up from the chemical assault. But when was his megacolon first clinically suspected, if at all? Could surgical intervention for his megacolon, such as a partial colectomy, have been considered earlier, even with the risks? And how much did the societal taboos around bowel health prevent a more open and aggressive treatment approach for this debilitating condition? Number 5, how did the drugs rob him of his breath, even without an obvious overdose? Respiratory depression is a silent killer, and it's a critical piece in understanding Elvis Presley's death, even if not listed as the sole cause. This condition means that breathing becomes slow and shallow, sometimes stopping altogether. It's a primary danger of central nervous system depressants, drugs that Elvis consumed in abundance. Opioids like Demerol and codeine directly depress the brain's respiratory center. They reduce the drive to breathe. Barbiturates and other sedatives such as Placidil and Quaaludes also have this effect. When taken together, as Elvis frequently did, their effects are synergistic, meaning they amplify each other. This combination creates a profoundly dangerous situation, especially during sleep, when natural breathing rates already slow down. The toxicology report after his death showed a mix of these depressants. While the report didn't explicitly state respiratory arrest, the presence of multiple central nervous system depressants at high levels strongly suggests that his breathing would have been severely compromised. Imagine his body, already weakened by chronic illness and drug use, trying to breathe while under the influence of these powerful medications. His brain wouldn't send the proper signals to his lungs. The consequence of respiratory depression is hypoxia, a lack of oxygen in the body. When the body doesn't get enough oxygen, every organ suffers, especially the brain and the heart. The heart has to work harder to pump oxygen-depleted blood, adding tremendous strain. For Elvis, whose heart was already enlarged and under stress from other factors, chronic or acute episodes of hypoxia would have significantly contributed to its eventual failure. Dr. Nicopolis recalled instances where Elvis would fall into such a deep sleep, his breathing would become very shallow, causing concern. This process is insidious. It's not always a dramatic, sudden cessation of breath. It can be a gradual decline in respiratory function that slowly starves the body of oxygen. Over time, this kind of stress can weaken the heart muscle and disrupt its electrical activity, leading to arrhythmias and ultimately cardiac arrest. In the context of polypharmacy, where multiple depressants are involved, the risk is incredibly high. The medical community has since developed a much clearer understanding of the dangers of combining these drug classes. But in the 1970s, while the risks were known, the aggressive prescribing of such combinations to a single patient, particularly a celebrity, highlighted a systemic failure to protect patients from these lethal interactions. But were his breathing patterns ever objectively monitored during his deep drug-induced sleeps? Did his doctors consider the cumulative effect of these depressants on his respiratory drive as critically as they should have? And how often do similar subtle forms of respiratory depression go unnoticed in other patients using multiple prescribed medications today? Number 4, how did his mental state fracture under the weight of his drug dependence? Elvis Presley's drug use did not just ravage his body, it profoundly affected his mental health, shattering his emotional stability and contributing to periods of paranoia, mood swings, and deep depression. The chemicals altered his brain chemistry, and the lifestyle surrounding his addiction created a pressure cooker of psychological distress. The chronic use of multiple psychoactive drugs has well-documented psychiatric side effects. Amphetamines, which Elvis used to stay awake and energized, are known to induce paranoia, anxiety, and even stimulant psychosis, characterized by delusions and hallucinations. Accounts from his Memphis Mafia members often describe Elvis's increasing paranoia in his later years. He became intensely suspicious of those around him, believing people were plotting against him, stealing from him, or trying to control him. He would sometimes carry firearms and even discharge them inside Graceland, fueled by these delusions. His former bodyguard, Sonny West, detailed such incidents in the book Elvis, What Happened. Conversely, the constant use of depressants, opioids, barbiturates, and sedatives could lead to profound depression and emotional blunting. While these drugs might offer temporary relief from pain or anxiety, their long-term effect often deepens depressive states. Elvis was known for his extreme mood swings, moving from euphoria to profound despair. He would isolate himself, spending days in his room, often in a drug-induced stupor, grappling with profound sadness. This cycle of ups and downs, chemically induced, was devastating to his mental well-being and his relationships. The addiction itself was a source of immense psychological distress. The shame, guilt, and the constant battle to obtain drugs and hide his dependence would have been a heavy burden. He was trapped in a cycle, wanting to be free but unable to escape the physical and psychological grip of the drugs. This sense of powerlessness and self-loathing would only exacerbate any underlying mental health vulnerabilities. His erratic behavior, often reported by those around him, including sudden outbursts of anger or fits of irrationality, could be directly attributed to the effects of the drugs on his brain. His ability to make sound judgments, process information, and maintain stable emotional responses was severely compromised. This wasn't just Elvis being eccentric, it was the manifestation of a brain under siege by powerful chemicals. Dr. Nick often tried to manage Elvis's mood and anxiety with tranquilizers like Valium. But simply adding more drugs to an already overloaded system rarely solves the underlying problem and often creates new ones. The polypharmacy contributed to a complex and often contradictory set of psychiatric symptoms, making it nearly impossible to distinguish between his original personality traits and drug-induced behaviors. But did anyone around him truly advocate for comprehensive psychological or psychiatric care beyond medication? Was the shame and stigma of mental health issues, especially for a male celebrity, a barrier to effective treatment? And how much did his fame and isolation exacerbate his psychological struggles, making him even more vulnerable to the grip of addiction? Number 3. How did the drugs visibly alter his physical coordination and speech? The impact of Elvis Presley's drug use wasn't just internal, it became visibly apparent in his physical demeanor, coordination, and even his speech. These neurological effects painted a clear, sad picture of a body and mind under the influence of powerful substances. For a performer known for his dynamic stage presence, these changes were particularly stark and heartbreaking to witness. Central nervous system depressants, which form the bulk of Elvis's drug intake, directly affect neurological function. Opioids, barbiturates, and sedatives all slow down brain activity, impairing motor coordination, balance, and fine motor skills. This could manifest as unsteadiness, clumsiness, or a general lack of grace. There are numerous accounts from his later concerts and public appearances where Elvis appeared less agile, less coordinated, sometimes stumbling or moving stiffly. He might struggle with simple tasks, or his reflexes would be noticeably slowed. Slurred speech was another common and noticeable symptom. Depressants relax muscles, including those involved in speech articulation. They also impair cognitive processing, making it harder to form coherent thoughts and speak clearly. Many concert recordings and eyewitness accounts from the 1970s describe Elvis's speech as thick, slow, or slurred, sometimes making it difficult to understand him. This was a direct result of the drugs affecting his brain and oral motor control. His eyes often appeared glassy, unfocused, or pinned, constricted pupils, which is a classic sign of opioid intoxication. This further contributed to his dazed and distant appearance. He would sometimes struggle to keep his eyes open, or his gaze would drift. This lack of engagement would have been a stark contrast to his earlier vibrant stage presence. These neurological effects weren't just cosmetic, they reflected a profound disruption of his brain's normal functioning. His reaction time would have been significantly impaired, making him prone to accidents. His memory would have been affected, contributing to his forgetting lyrics or parts of his stage routine. Friends and family noted his increasing inability to hold a coherent conversation or engage in complex thought. Priscilla Presley, in her memoir, describes moments where Elvis was physically present but mentally absent, lost in a drug-induced fog. The combination of stimulants and depressants would have created even more erratic neurological responses. His body would be jolted between hyper alertness and profound sedation, never allowing his nervous system to find a stable state. This constant chemical flux would have further exacerbated his coordination and speech issues, contributing to an overall appearance of disorganization and impairment. These visible signs served as a public testament to his private battle, signaling to those who knew him that something was terribly wrong. But did these obvious physical manifestations ever prompt a forced intervention by his management or family? Were the neurological effects of polypharmacy fully understood by his doctors in terms of long-term prognosis? And how much did his fame allow him to continue performing despite these clear signs of neurological impairment? Number two, how much did his dietary chaos and drug use combine to starve his body? Elvis Presley's eating habits were famously erratic and often unhealthy, but when combined with his extensive drug use, this created a perfect storm for nutritional deficiencies and exacerbated his overall poor health. The drugs themselves not only suppressed appetite or induced cravings for specific foods, but also interfered with nutrient absorption and metabolism. His body was, in many ways, being slowly starved of essential nutrients, even while he struggled with weight gain. One major way drugs contributed to nutritional problems was through appetite suppression. Amphetamines, which he took to stay awake, are well-known appetite suppressants. This meant he could go for extended periods without eating, or eat very little. While this might seem to counteract his weight gain, it meant he was missing out on vital vitamins, minerals, and macronutrients. Conversely, the profound sedation from opioids and barbiturates could lead to a general lack of self-care. When he was in a drug-induced stupor, he might simply neglect to eat or choose easily accessible, often unhealthy, comfort foods. His famous love for rich, high-fat, high-calorie foods like fried peanut butter and banana sandwiches, while a personal preference often meant his diet lacked crucial fiber, vitamins, and minerals found in fruits, vegetables, and whole grains. The severe chronic constipation exacerbated by opioids and his megacolon also played a role. A backed-up digestive system cannot efficiently absorb nutrients from food. Even if he did eat, his body might not have been getting the full benefit. This means his cells could be starving for essential building blocks, even with calories going in. Drugs also affect metabolism. Some drugs can deplete the body of certain vitamins and minerals. For example, some sedatives can interfere with the absorption of B vitamins. Chronic drug use places enormous stress on the liver and kidneys, which are crucial for processing nutrients and toxins. If these organs are struggling, the body's ability to utilize nutrients effectively is compromised. His rapid weight fluctuations, often swinging between being overweight and attempts at crash dieting, would have further stressed his system and contributed to nutrient imbalances. This was not a healthy body, nor was it being fueled correctly. The lack of proper nutrition would have weakened his immune system, made him more susceptible to illness, and impaired his body's ability to repair itself or cope with the stress of the drugs. This systemic weakening would have contributed to his overall decline in health, making him more vulnerable to the final cardiac event. Members of his entourage recounted stories of Elvis consuming vast amounts of food when he was up, and then eating almost nothing when he was in a drug-induced state or trying to diet. This chaos in his eating habits, combined with the physiological effects of his drug regimen, ensured his body was never truly nourished. But how much did his doctors attempt to address his nutritional status beyond weight management? Were specific vitamin and mineral deficiencies ever diagnosed and treated? And how often do drug-induced nutritional deficiencies go unaddressed in patients today, especially those on multiple medications? For number one, what did his body finally reveal about the years of silent struggle? The autopsy performed on Elvis Presley's body after his death on August 16, 1977, provided critical insights into the years of silent struggle his body endured. While the official cause of death was acute cardiac arrest, the post-mortem examination, combined with subsequent toxicology reports and investigations, painted a far more complex picture of chronic illness, organ damage, and the profound impact of long-term polypharmacy. One of the most significant findings was the severely enlarged and elongated colon, a condition known as megacolon. It was found to be twice its normal length and diameter, and packed with several months of hardened fecal matter. This physical evidence corroborated the long-standing accounts of his debilitating constipation and provided a clear medical basis for his gastrointestinal agony and his reliance on laxatives and opioids. It showed how profoundly his internal plumbing had been compromised. His heart was also found to be enlarged, a condition called cardiomegaly. This is consistent with a history of hypertension and long-term strain on the cardiovascular system. The enlarged heart muscle would have been less efficient at pumping blood, contributing to the ultimate cardiac arrest. This finding aligned with the chronic stress his heart experienced from stimulants, depressants, and his fluctuating weight. While the original autopsy report by Dr. Jerry Francisco did not initially emphasize the drug factor, the later toxicology reports were damning. They revealed the presence of multiple powerful prescription drugs in his system at the time of death, some at levels considered highly toxic or lethal for an average person. These included high concentrations of codeine, as well as significant levels of other opioids: Demerol, Percodan, barbiturates, phenobarbital, sedatives, Valium, Placidol, Quaaludes, and other compounds. The cumulative effect of these depressants on his respiratory and cardiovascular systems was undeniable. Medical experts who later reviewed the case, like Dr. Forrest Tennant, a forensic toxicologist, concluded that Elvis's death was a polypharmacy overdose where the combination of drugs, even if individual levels weren't immediately lethal, synergistically suppressed his vital functions. The consensus in the medical community evolved to recognize that while a heart attack was the immediate trigger, it was the chronic and acute drug intoxication that created the conditions for that heart attack. His body was simply too compromised to recover. The autopsy also found evidence of generalized poor health. His lungs showed signs of emphysema, possibly related to heavy smoking and chronic respiratory stress. There were signs of widespread inflammation, and his liver and kidneys, though not an outright failure, would have shown the strain of years of detoxification. His overall physical state was that of a much older man or someone who had endured immense physiological stress. His death was ultimately a tragic example of iatrogenic addiction and subsequent health decline caused or exacerbated by medical treatment. The autopsy and subsequent analyses laid bare the devastating consequences of unchecked prescription drug use, chronic pain, doctor shopping, and a system that failed to protect him. It transformed his death from a simple heart attack into a complex medical and ethical saga. But why did it take so long for the full truth of his autopsy and toxicology to become public and widely accepted? How many other unexplained deaths of the era might have similar underlying stories of polypharmacy and prescription drug abuse? And what lasting changes did Elvis's case bring to how prescription drugs are monitored and prescribed, especially to high-profile individuals?